Hi, welcome to our 8th Fall Prevention Month lunchtime talk. Yesterday we had Tilak Dutta speak to us about how we can stay active and prevent falls. He gave us different strategies and also talked about different technology that can help us in staying active. Today we have Marla Beauchamp and Sachi O'Hoski coming to talk to us about chronic obstructive pulmonary disease, or COPD, and how this population is at risk for falls and how come. They're going to tell us some more about that. So Marla is a scientist. She works in respiratory research at West Park Healthcare Center, and Sachi is a physiotherapist at West Park as well. So I'll pass it on to them.
Hello, so thank you for having us here today. The topic of falls in people with COPD is a really important one and something that we've really only been talking about for the last 5 to 10 years. So COPD stands for chronic obstructive pulmonary disease, and this is really an umbrella term that includes a number of different lung diseases, the most common of which are chronic bronchitis and emphysema. COPD results in chronic cough and shortness of breath, which ultimately makes it harder for people to breathe over time. In Canada, COPD is currently the 4th leading cause of death, and it's projected to be the 3rd leading cause of death in Canada and in the world by the year 2020. There's no cure for COPD, so it's managed mainly through medications and through respiratory rehabilitation. Although COPD is a lung condition, it actually affects a number of systems diverse from the lung. COPD can cause things like system-wide inflammation, low blood oxygen, nutritional abnormalities, and these secondary effects of COPD often contribute to other alterations like decreased muscle strength and endurance, osteoporosis, anxiety, and depression. And what's striking about this list is actually many of these are known risk factors for problems with balance and increased falls. So we've actually extensively studied balance in people with COPD and compared balance in these patients to people of the same age without COPD. And what we found is that consistently people with COPD have lower balance scores. So in this graph, we have patients with COPD in the dark blue squares, and we have people without COPD in the light blue circles. And on the y-axis is a balance scale, with higher scores indicating better balance. And what we see is that matched for every decade of life, people with COPD have lower balance scores than what we would expect based on their age. In another study, we actually brought patients into a specialized lab here at Toronto Rehab and tested their ability to recover from unexpected perturbations to their balance. So we had patients in a harness with a cable attached behind them, and then we suddenly released the cable and patients had to step to recover their balance. And because we had force plates right here, we were actually able to measure this response. And what we found is that in people with COPD, not only did they have more sort of simulated falls, so situations where either one of us had to step in and catch the patient or where the harness had to catch the patient, but we also noticed that people with COPD had slower stepping reactions. So they had an impaired ability to recover their balance in the event of unexpected perturbations. And so the important point about this information is that we now know that balance problems are common in people with COPD, and this likely increases their risk of falls. So the topic of falls in people with COPD is actually a very new area of research. We still don't know a lot, but what we do know is very compelling. So in a large study of thousands of elderly women, it was found that COPD was second only to osteoarthritis in its association with falls. In 2 studies where we've actually followed and tracked people with COPD over time, we found that the annual fall rate was up to 5 times higher than the rate for older adults. And in a recent analysis from the Canadian Community Health Survey, which included more than 16,000 older Canadians, COPD was the only chronic condition that predicted falls. So these data really tell us that balance problems and falls in people with COPD is something we need to be paying attention to. But there's good news. There's a lot we can do to help. So I'm going to pass it over to Sachi O'Hoski now, who's a physiotherapist in respiratory rehab at West Park, and she's done a lot of work working with these patients.
Thanks, Marla. So as Marla said, it's not all doom and gloom when it comes to balance and fall risk. There are things that we can do to improve our balance and decrease our risk of falls as we age. And exercise is a huge part of that. In a review of 159 interventions that included over 79,000 people, they found that multi-component home and group-based exercise programs were effective at reducing rate of falls, risk of falls, and also risk of fall-related fractures. Overall, exercise programs that include balance, coordination, gait, and functional activities tend to have the greatest effect on measures of balance. So how do you know if this is something that applies to you? Well, as Marla already stated, if you have lung disease, then you may be at increased risk of falls. You also may have noticed already that you have unsteadiness or you feel unstable on your feet. The other thing we would ask is if you have a history of falls. So have you had a fall within the past year? There are also simple screening tests you can do. As you can see here, a single leg stance. So standing on one leg. It's important if you are going to try this that you be in a safe environment and have someone or something stable close by that you can hold on to for support. If you can't maintain your balance standing on one leg for at least 10 seconds, or if you feel very wobbly when doing so, then you may have a balance impairment. So if you have a history of falls, or if you're unable to maintain your balance while standing on one leg, we would encourage you to speak with your healthcare providers about resources that may be available to you. A physiotherapist can do a more in-depth balance assessment with you, give you exercises to improve your balance and reduce your risk of falls, and also connect you with community balance programs in your area. Thanks very much.
Thank you very much, Sachi and Marla. I was wondering if the public has any questions for them. Yes.
Are there specific recommendations for exercise for people with COPD? Because presumably they can't exercise very vigorously because of the issues with breathing.
Actually, there are and there aren't. So we've done trials of balance training in people with COPD, and we've had no problem doing a number of different balance exercises that we would commonly do in general geriatric rehab programs. The only thing is that we've actually done some work to show that some of the balance deficits that people with COPD have are quite unique to this population. So it just means that we have to focus on specific areas. And maybe you can add to that.
The only other thing I would add is that they may need more rests. So because of breathlessness, they may need to take more breaks during their balance training. But in terms of the specific exercises, for the most part with the work that we've done, they're able to do exercises that we would prescribe for any other geriatric population.
We were talking a little bit earlier about a case where we had a person come to us to ask if the oxygenators that are often used in the homes for people who have COPD, there's a challenge with there's a hose, an oxygen hose that the person has to have attached to them, and usually there's 30 or 40 feet of hose that they have to manage as they move from, say, the couch to the bathroom. They have to turn up their oxygen supply before they can move around in that space. You know, if they have a higher demand, or if they're at rest or at lower demand, they have lower oxygen need. And there's this need to kind of modulate that oxygen, and there's this cord that they have to manage. I was surprised to hear that first of all, there's not really a good automated way. It would seem like we should have a simple way to control the oxygen from, remotely through a little remote or something. And then that people don't really trip over the cord. I wonder if you could just comment on those points.
Well, maybe I'll comment about the tripping first. That's actually, anytime we present these results or anything similar, one of the questions we always get from clinicians especially is, do patients trip over their oxygen tubing? And actually, we've now worked with hundreds of patients with COPD and asked them about their fall history and balance. And we actually have only noted it to be a problem maybe in 2 instances, and maybe 2 falls out of maybe hundreds that we've looked at. So actually, this is not the reason for the increased falls that we're seeing in this population. However, if you speak to patients themselves, they'll say, "Oh yes, that darn tubing, I trip on it all the time." So, so who knows? But yeah, we haven't actually noticed it to be a problem. As with respect to the remotes, I'm going to pass it to Sachi.
Yeah, as we were talking about before, I think that's more a question for the excuse me, the oxygen provider, the companies themselves. But I think it would be a great thing to have a remote so that patients weren't having to get up all the time and go back and forth to their concentrators and change their change the amount that they're getting. Yeah.
Any other questions?
Do you have an idea what causes the balance problems in COPD? Is it more muscle weakness versus central nervous system, or?
This is something that we still need to sort of figure out. But basically, the data that we have so far suggests that it's really multifactorial. So yes, it has something to do with muscle weakness. It has something to do with patients being less physically active. It might have something to do with lower blood oxygen. It also might have something to do with what else was I going to say? Anemia and some of those sort of comorbidities that we commonly see in COPD. So it's hard to sort of say it is any one thing. So I think it really is a combination of factors. Anything to add? No? Yeah, but good question.
Any other questions?
Okay.
Thank you so much. It was great to learn more about COPD. So also really interesting to hear that they have impaired balance control and are at higher risk for falls. Tomorrow, we will be talking about Falls Lab, which is a motion platform that we have here at Toronto Rehab, and learning a bit more about how we use this platform to learn about fall risk and some of the balance control mechanisms that go into reducing fall risk. So please join us for that. We will also be having a tour after our presentation tomorrow of our research facilities, and we'll be making a special stop for you to be able to see Falls Lab and to even test it out. So if you join the tour, you will have the opportunity to go on the motion platform and experience a small motion and see how you're able to recover your balance from that. Rest assured, you will be harnessed up, so there'll be no significant risk involved. But yeah, so please join us tomorrow. As a reminder, you're able to see all our talks as well on through our webpage and our YouTube channel. So please check out trihomeandcommunity.com/falls to get more information about all the things that we have planned and to see all our videos. So thank you very much for joining us today.